everyone, welcome to SCube TV. I am your host Rajni Bharara, and today on the show I have with me a very special guest. His name is Dr. Chava Anjaneyulu, and he is an ENT surgeon. Guys, today on the show we are going to speak with him about problems related to ears, nose and throat. But before, let's welcome him to SCube TV. Hello doctor, welcome to SCube TV.
Thank you.
So doctor, before I start the interview and before I ask you all the questions, I actually would like you to introduce yourself to the audiences, and also if you can please talk about yourself and how did you become an ENT surgeon?
Yeah, I am myself Dr. Chava Anjaneyulu. I am ENT surgeon. I done my post-graduation from All India Institute of Medical Science, Delhi. And later I came to Hyderabad and I started Asian ENT Care Center. I worked with Nizam's Institute of Medical Sciences and LV Prasad Eye Institute. Now I am working with Apollo Hospitals, Jubilee, Hyderabad. And I completed MBBS from Guntur Medical College. I want to join in ENT AIMS. There I got my seat also. Further, I continued as a junior resident, senior resident. I worked as assistant professor there. Later, I came here and I started this Asian ENT Care Center organization.
Thank you so much for the introduction, Doctor. So, Doctor, let's start the show. And my very first question to you is, if you can, please talk about. So, firstly, I will begin with ears. If you can please talk about, what are the common early signs and symptoms of hearing loss?
Usually, in the hearing loss, patient early signs, most of the times previously we see that the hearing loss mostly in elder people or kids, children. That is children due to congenital hearing loss and elder people due to age-related hearing loss. That we call it as a presbyosis. But nowadays, due to different reasons, different causes, we are seeing in the young children, like around 10, 15 years age, and middle-aged persons also. In young children, we see mostly due to the infectious reasons. Some kids, they get that viral infections that cause the hearing loss. But if you see the middle-aged people, mostly nowadays we are getting many hearing loss due to the noise-induced hearing loss. Maybe due to loud noise exposure or continuous use of the earphones, or using earphones for listening songs and watching movie continuously. This continuous noise exposure will cause the hearing loss. Usually, initially, patients will find there is some difficulty in understanding and some ear discomfort, ear fullness, all these things they will start. And later that they will find that their hearing is not up to the mark, and they come for the testing.
But doctor, also, ringing in the ear normal as one is getting older, because sometimes it happens that we hear that ringing noise and ringing sound. So is it normal as we get old, so we tend to listen to that sound?
Elder people, it is common, because in elder people, as age increases, some cell degeneration will go on in the inner ear. That is outer ear cells in the inner ear. When the cells degenerate, automatically little bit hearing loss will happen. Along that hearing loss, patient will get the tinnitus. But always we have to see the reason also, because most of the time this may be the reason. Some people, they will get due to either vascular tumors or CP angle tumors. Always when the patient comes with the tinnitus problem, we have to do radiological investigation to rule out that issue. Always it is very important.
Because the wax of the ear, does that cause deafness?
Yeah, wax always cause deafness, because it will prevent the sound waves transmission to the middle ear and inner ear. Whenever ear is full with wax, it will definitely cause the hearing loss, and the patient will less hearing. Once they visit the patient doctor, they will see if it is wax. Immediately they will remove. Immediately patient will get a lot of benefit as they are hearing normal. Sometimes they will find we are hearing more, because till that time they are not listening anything. So suddenly they listen and they find, okay, we are listening a lot. But that is common.
Okay. Yeah, it's pretty common also. It also depends on the hygiene too. So now I actually would like to know from you, in the back in the day, in the earlier times, people used to use oil drops. They used to use oil for cleaning their air. So then with the coming times, people said that it is harmful for your ears and you should not use oils, and you should not put oils in your ear. So what would you say about that?
Yeah, it is always better not to use the oils. In olden days, to dissolve the wax, they don't have any other like D-wax, some sophisticated ear drops are present. What we are using that to scientifically proven the ear drops. In the days, what they do is they will warm the oil. To warm, why they are warming is to destroy the bacteria or virus in that oil. Sometimes what they do, little bit hot oil they will put into the ear, and that will cause the burning of the ear canal. If you don't warm the oil, if you put directly oil, in oil sometimes even if we see in oil, sometimes we see the foreign bodies, small ants, all those things, it will stay, it will go into the ear. So both ways it is not good, but oil is not at all good. Some people, they may have reaction to the oil. So either normal oil, hot oil, both are harmful to the ear, and oil is always better to avoid because it is not good at all, because in either way. And it will not weaken or thin the wax that much as effectively as the wax dissolving drops.
So is there a particular brand of wax dissolving drop that you would like to recommend people so that which you can, which they can use for cleansing their air?
Yeah, nothing like, every brand is good. If we go to wax dissolving drops, they will give the different brands. Many companies, they are manufacturing this thing. So any brand is okay because that the main component of that brand is that component in that oil is same in all brands. So no need to worry. So you can take any brand, wax dissolving drops, you can use that and you can thin that wax. Later doctor will remove that wax.
Okay. Also, is there a particular home remedy? Something that we can use that for cleansing the ear so that it doesn't harm the ear. So, and also we can clean it deeply.
No, it is not possible at all to clean the ear in the home. Till now, no device came for home cleaning of the wax.
Okay, got it. So now, doctor, I would like to speak with you about allergies too. So, when allergies happen to people, so they don't know whether it is their allergy that is making them sick or it is the common cold that is happening to them. So if I ask you as an ENT, a surgeon, what would you say? How can a person differentiate whether they are having cold or it is the effect of the allergy?
Usually, most of the times, allergy patients will have sneezing and nasal discharge. But with cold initially, because cold is due to viral infection, patient will get along with the sneezing, nasal discharge, nasal blockage sensation, fever, weakness, all these things will add up. So most of the times, cold, it is very easy to differentiate from the allergy. And many people, those who have the allergy problem, they know it is by their body response itself. Only simple sneezing and rhinorrhea, it may be due to allergy or sudden exposure to the dust. But if it is throat pain, facial pain, or body weakness, that is due to cold.
So somehow, so if we somehow get the allergy, the dust allergy, or if we eat something unconsciously and then we get the allergy and we don't even know about it. So what is the first necessary step that one should take when they get the allergy?
First thing is they should come out from that factor which initiate our allergy. Sometimes it may be strong smell, sometimes it may be dust, sometimes it may be pollution like vehicle pollution or industrial. First you come out from that and don't expose to that for some time, at least 15 days, 1 month. Otherwise, if you expose again, that inflammation will go up and it will cause more and more problems. Sometimes 2-3 expose, single exposure, most of the times it will not cause for months together. But if you expose within few days to the same allergen, sometimes it may cause a persistent inflammation and you will suffer from years together. So better whenever you find something which is irritating you, which is causing sneezing to you, better to avoid and don't expose to that.
Okay. And also, is there a particular medicine that we can take in the form of anti-allergy?
Yeah, at the time, if you expose first time to the allergy, if you are having the sneezing and nasal discharge, take one anti-allergy tablet like fexofenadine, levocetirizine, anything is okay. And that will help to prevent further inflammation and fast recovery. And it will prevent the spread of that allergy to the other mucosa, which is not exposed.
Okay. And let's suppose if we get the allergy in our skin and something, the burning sensation or pimples or redness, if something like that happens in the skin. So can those two particular tablets or medicines work in the skin allergy too?
Yeah, that will help you. And along with you may need local anti-allergy creams to skin. But in other areas, nasal and throat, you may not have. There you use inhalations or nasal sprays. But in skin, along with the tablet, use that to steroid, some anti-allergy creams.
Okay, great. So, doctor, also my question to you is, can allergies be cured permanently?
Yeah, nowadays we are doing allergy skin prick test and we are treating with immunotherapy. Along with that, you prevent some, where is the mucosa, that is posterior nasal nerve mucosa, turbinate mucosa, those you induce little more fibrosis. So inducing fibrosis in the mucosa and along with immunotherapy, it is giving a lot of relief to the patients. Sometimes it is almost a permanent relief. Even sometimes we are doing some temporary procedures like turbinate reduction procedure, submucosal fibrosis of inferior turbinate. That is also helping patients are getting relief for 2-3 years also. Nowadays we are getting people after 2-3 years, sir, that time we got that small procedure, can you do again? Because always it may not work. First time, sometimes, most of the times it will work. Second time, if patient comes with you, have to increase your treatment more, like same procedure along with immunotherapy.
How can we know that it is the time now, we need glasses? Because, sometimes it happens that we feel the irritation that we are having in our eyes is because of the constantly watching something on television or on our phone. But then how do we differentiate our eyesight getting weak and us needing glasses to wear?
Yeah, frankly, I'm ENT surgeon, but little bit I will give insight into that. Yeah, but I don't know in detail that, but I will briefly. It's a little bit irritation and watering of the eye. It may be due to inflammation, maybe due to dust exposure or minor viral infections. But if you are not seeing properly the little bit distant letters, that is due to refractive error. At the time, you have to get in older people to rule out the cataract and other retinal problems also. So simple irritation and temporary few seconds visual disturbance, it may not give trouble, but always better to check by the ophthalmologist to check especially anterior segment and posterior segment of the eye.
So now, doctor, also I would like to know from you about throat too. So when we have throat ache or throat pain, so at that time, what is the first step that we should take? And especially in the times of COVID, the virus actually affected our throats, first. What should we do? And at a home level, when we can't go to the hospital and when we don't have doctors nearby, how can we treat it at home?
Yeah, better is whenever you get that throat discomfort or throat pain, you take little bit of water more times. And only few times you take warm water. Some people, what they do, every 10 minutes they take warm water. That is not good at all, because it will harm your mucosa and it will damage further your mucosa. So take once or twice little bit warm water. In between you take more water and more times, every 10-15 minutes. So cells will hydrate and cells are in a healthy position. Second one, morning and evening you take steam inhalation, that will prevent there the mucus accumulation. So that is another good thing. Third one is speak as less as possible. If you speak more, it will traumatize more, because whenever our body organ, any organ, it will get damaged or infected, you should give the rest to that organ to reduce the inflammation. So speak as less as possible. And simultaneously, if you have any SD problem, take antacid tablets. If you have any allergy problem, take anti-allergy treatment. Like that, if you do all these small precautions and along with the rest, most of the times this early stage throat infections will subside. If it stays for more than 2-3 days, if you are becoming more weak and pains are more and body pains along with muscle weakness is there, better to contact the doctor.
And how can we also take care of our throat then? Because people normally don't. They take care of their ears, eyes, nose. But when it comes to throat, they don't care about it as much as they do about other organs. So how can we take care of our throat?
Yeah, throat main thing is you don't allow the throat to dry. So take more water. And that also more.
Hydrate.
Yeah, hydrate the throat. Every 10-15 minutes you take sip of water along with the routine your water intake. Second one, speak as less as possible, but properly speak it slowly and don't do very fast. And whenever you are speaking, if throat get irritation, don't do like that. If you do like that, already dehydrated cells, further it will damage, it will give the fibrosis. Once a fibrosis happens, it is very difficult to come out. So don't do like that while speaking. So most of the times, these 2-3 precautions along with the lifestyle management avoid the stress also. Stress is another cause which induces the throat to dryness and that indirectly cause the throat discomfort and damage, and avoid the polluted atmosphere as much as possible. So if you change like that, if you use a very healthy lifestyle in a way of avoiding infusions, avoiding spicy food, avoiding oily food, take little bit more water, All these will help you to keep your throat very healthy.
Doctor, also, can you please speak about sinus too? Because a lot of people get sinus and, they go to doctors. And I mean, it normally doesn't get cured completely. So if I ask you, how can they take care about it?
Yeah, sinusitis most of the times will get like once or twice in lifetime. Many people, but some people will get once or twice in 2 years, 3 years. That is normal, because once in a while getting sinus infection, it will subside within 5 days. It is not a problem. It is common thing. But getting sinus infections every month, 2 months, or with the season change, it is not good. If you have a problem of nasal obstruction, nasal discharge, sneezing, facial pain, better to get examination by the ENT surgeon. They do basically ENT examination, the diagnostic nasal endoscopy. In nasal endoscopy, they will see in the nose any deviated nasal septum, any turbinate hypertrophy, any polyps are there. If you have facial pain, get one CT scan of the PNS. There you will find all the signs are healthy or not. So with these two investigations, we know the sinus stage. And if you have any sneezing problem, nasal discharge problem, better to get the allergy skin prick test also. There we find any allergy is there, any specific. Nowadays we see many allergens like dust mite, mouse dust, and some people they are pigeons, some people they have dog allergy, all these things. So we know that. So we can avoid all these predisposing factors along with that. So diagnosed by the nasal endoscopy, CT scan, and allergy skin prick test, it will tell you all your sinus problem related issue completely. So you can treat very nicely, and we can get the cure of that sinus problem.
Thank you so much, doctor. But before I let you go, one last question. How can we completely take care of our ears, nose, and throat? And also, is there a particular myth that you would like to burst about that people have a belief in?
Yeah, basically, if you see nose, throat, ear, common problem is the allergy problem. If you have any allergy in the nose, it will cause ear problem, it will cause you throat problem. So avoid as much as possible polluted atmosphere around you. Whenever if you are going to the polluted atmosphere or in the road, better to use the mask. Nowadays we are using for a coronavirus prevention, but otherwise it will help to prevent the allergy. So along with that, if you do the breathing exercises, that will clear your nose very perfectly, and it will help your throat also to clean perfectly. So these two things will help. So doing breathing exercises. If you have any allergy, do some Jalaneti to clear that all allergy particles from the nose. Along with that, prevention of this polluted atmosphere, especially air pollution, it will help you to not to get routine problems of the ear, nose, and throat. Because the nasopharynx, the common site, will give trouble to the nose, throat, and ear, where it will connect to the eustachian tube, it will go into the oropharynx, and all those things. So by doing this pranayam, breathing exercise, Jalaneti, it will help to prevent further problems of these three organs.
Okay, so yoga is something that you can practice every day to help these things get better.
Yeah.
Great. Thank you so much, doctor, for coming to SCube TV and speaking with us. It was an informative conversation. Thank you so much for providing all the information about the questions that I have asked, coming to the channel and speaking with us.
Thank you very much, man. Thank you.
All right, guys, that's it from SCube TV. Keep on watching and do subscribe to the channel.